Hey guys, welcome to another video. In this one, I'm going to be answering some questions that were left in the comments section of previous videos. So let's get to it. First question is from Belinda. Weird question about estrogen. My daughter has been on hormone replacement therapy for over 2 years. During the first year, it took forever to get her estrogen level up to the appropriate level. All of a sudden, about 6 months ago, her level jumped to 1400. This is a danger level. They took her off for a bit, then gave her the lowest dose of estrogen. Her level is still over 900. What might cause this? Food, medicine, environment, or illness? This is a question that should definitely be addressed by an endocrinologist and or a gynecologist. And I probably will have nothing to add in addition to what her gynecologist and endocrinologist is already saying. Most likely it's a matter of adjusting the amount of hormone replacement therapy. But to answer your question, other medicines and food can actually affect hormone levels and levels of other medications. And on top of that, it's still possible for there to be an underlying medical issue, whether that's with the pituitary gland, the adrenal glands, or the ovaries. So that's definitely something that should be looked at by her endocrinologist. Leslie asks, what's the best way to get rid of cravings? It's so hard to eat clean all the time. Yes, I know what you mean, Leslie. So I made this change about 6 months ago where for the last 6 months, I've been pretty much eating nothing but clean food with exceptions here and there. And I would say there's 5 key factors to getting rid of those cravings, or at least minimizing those cravings, because you might not get rid of them completely. Starting with number 5 is getting good sleep, because when we're sleep deprived, the cravings go up. Number 4 is minimizing stress in your life. Some things are in our control, some things are out of our control, but you want to do as much as possible to reduce your amount of stress. Number 3 is exercise, because when you're exercising on a routine basis, it does help to reduce the cravings for the things that you shouldn't be eating. And number 2 is changing the food that you're eating. So the types of foods that you eat can actually impact your hormones of ghrelin and leptin. These are the hormones that affect insulin and affect your cravings. Ghrelin makes you feel hungry, leptin makes you feel full. So when you're eating foods that actually impact these hormone levels, you want to have that ghrelin be down and the leptin go up, more like that. When that happens, the cravings will go down. So when you get those cravings, don't worry about the amount of food you eat, focus on the foods that you should be eating, and it's okay to eat more of those foods. In general, those foods are going to be unprocessed foods and things that make you feel full for a longer period of time. So we're talking about complex carbohydrates. There's 2 types of complex carbohydrates that you can eat. You're going to want to eat the one that contains more amylose and not amylopectin. In general, that means you want to focus on eating things that contain healthy fats like avocados and the complex carbohydrates that contain more amylose and less amylopectin. So starch, it's amylose and amylopectin. The foods that contain higher amounts of amylose as opposed to amylopectin would be things like oatmeal, quinoa, barley, rye, and other whole intact grains. For example, Ezekiel bread is whole intact grains. It's unprocessed, as opposed to pretty much every other bread that you eat out there. So if you're gonna eat bread, go with Ezekiel bread. When you're eating clean and you're not eating any processed food or added sugar, you're definitely gonna have cravings that are worse in the first 3 weeks. Every day that passes, it's gonna get a little better after that, but definitely the first 2 to 3 weeks are the worst, and then it becomes easier to deal with after that. Now, when you're doing all 5 of these keys together, with time, that's what's going to get you past those cravings, or at least help to minimize those cravings. Horsepower Enthusiast asks, Moderna vaccine. How would I know if it's a gene therapy that modifies my DNA? And is there a natural way to detox it from your body from having any significant effects to your body? So Moderna and Pfizer vaccines are both messenger RNA vaccines, mRNA vaccines. They do not mess with your DNA. They are not able or capable of modifying your DNA. In fact, there's only one technology out there that can modify your DNA, and that is CRISPR technology. So for example, with CRISPR technology, they use that to modify genes of sickle cell disease. Sickle cell disease is a genetic mutation that causes one amino acid to be abnormal, and it affects the entire protein. So for example, with CRISPR technology, they use it on a patient with sickle cell disease where they change the DNA of the mutation so that it's now normal DNA that codes for a normal protein. One of the biggest problems with CRISPR technology, though, is that it's super expensive. But back to your question, with these mRNA vaccines, Moderna, Pfizer, they're not going to be able to mess with the DNA. Andrew asks, will you only get monkeypox once like chickenpox, or can you get it again? Also, how effective is the Jynneos vaccine? It's highly unlikely that you'll be able to get it more than once because, unlike COVID, it's not having rapid mutations that cause these different strains or different variants. And the vaccine is very effective. The problem with it is that it's just not available in high amounts of numbers as of right now. But I will be making a video that's dedicated to this topic, so check that out for more details. Tiffany asks, are you still contagious after 5 days of isolation after COVID? What if testing positive after 5 days but before 10 days? So you're highly unlikely to be contagious after 5 days, although that's an arbitrary number, and sometimes you have exceptions to that rule. But it's still very possible that you can test positive after 5 days without necessarily being contagious. And the reason for that is because you still have remnants of the viral antigens, and those viral antigens, even though they're no longer causing active infection, they can still cause that antigen test to become positive. Michelle says, I was in the ICU with Delta COVID last year. I had double pneumonia, sepsis, and ARDS. My blood oxygen level was 68 when I was admitted. My pulmonologist suspects I now have lupus that was triggered from severe COVID. Do you think it's possible to develop an autoimmune disease or condition as a result of severe illness? It's definitely possible to develop an autoimmune condition after having a viral infection or even a bacterial infection. For example, we know that with certain infections, they cause some autoimmune diseases, such as Guillain-Barré syndrome. And actually with COVID, I've actually had some patients who've had Guillain-Barré syndrome after getting COVID. That's actually, I don't want to say common, but it does happen. Guillain-Barré syndrome can also occur after other viral infections and also some bacterial infections like Campylobacter infection. Lupus is not something that's known to develop as a result of infection though. So lupus, even though it is an autoimmune disorder, it's not necessarily known to develop after an infection. If lupus is the diagnosis, it's probably just a coincidence and not necessarily a result of the infection. Richard says, hey doc, thanks for providing a ton of information regarding COVID. I found it very informative. I'm planning on attending an indoors concert in a few weeks. A week later, I have a trip scheduled to Europe where I need to have a negative COVID test. Is there anything I can do, like wearing a mask to keep myself healthy, or should I just skip the concert? Richard, this is a great question, and first of all, thank you, and you're welcome. This is actually the exact question that my sister asked me because she's also going to a concert, and she said, should I skip the concert because COVID is so prominent right now, or is there anything else I can do? The one and only time that I got COVID was actually from a concert. 2 days later, I had symptoms, and no, I did not wear a mask at the concert. If you really don't want to get COVID, I'd say skip the concert, but you would most likely not get COVID if you were to wear an N95 mask at the concert. Is it convenient? Of course not, but it's a way around it. Meat in My Teeth asks, what do we know about Omicron and blood clots in pregnant women or their placentas? Is there less likelihood with the newer variants from Delta? It's really hard to know at this point because most of the studies were done on the original strain of COVID. So as these new subvariants emerge, it's hard to know if they're going to still have the same effects as the original COVID. So at this point, only time will tell. Pepe Lamoco asks, my question is BA5. If it can affect and reinfect a person multiple times, what's the difference between this and bats and gain of function testing in the Wuhan Institute of Virology? Well, this is a question that would be best answered by a virologist, but in the lab, they're specifically modifying specific genes of that virus, as opposed to in nature, when it's evolving with all these subvariants, it's random mutations here and there that end up causing different changes in those proteins. Heather asks, I have a question to ask you about monkeypox. So far, there are over 2,000 new cases of the disease in the US per CDC. Who is most at risk? And if you are a frontline worker in the health field like myself, who deal with the public on a day-to-day basis, do you think that the population of workers should be vaccinated for the monkeypox? So 2 parts to this question. The people who are most at risk, based on the studies, it's 98% men who are either bisexual or homosexual. Most of this virus is being transmitted by sexual means. This virus is mostly spread through direct contact, although it is possible for it to be spread by large respiratory droplets. I think it's a fair question to ask, should healthcare workers be vaccinated? I think at this point it'd be too early just because it wouldn't be practical based on the numbers. Since it's spread mainly through direct contact, the most important thing is to wear gloves when touching patients and also to wash your hands appropriately. So right now, with the vaccine having limited availability, it should be focused on those who are at highest risk. Moises asks, hi Dr. Mike, I live with my immune-compromised mom. She's not very consistent with keeping healthy habits like regular exercise and a healthy diet. She's also not a fan of vaccines. She got the first 2 COVID shots, but refuses to get boosted. Besides being her chauffeur for her doctor appointments, what can I do or say at home to help her make healthier choices? Well, at the end of the day, she has to want to do it. If she doesn't want to do it, it's not going to happen. So if I were you, I would focus on why it's important to make healthier choices. Open asks, hello, what is the best way to use the computer if you have mild carpal tunnel syndrome? Any good treatments besides surgery? Carpal tunnel syndrome is something that I probably had for a while after using the computer so much. And I don't know if it's arthritis or not, but my wrist cracked a lot. So try to limit your time on the computer. Ed asks, on COVID, what is primarily driving rapid viral mutations here? Evolution trying to defeat our vaccines, or just evolution in general? Are we headed down the same path as antibiotic overuse and creating a superbug in the process? Would we be better off just to accept a mild variant as something as we all must eventually go through? Surely the plague of 1918 offers some guidance. Here's the thing, biology is biology. We are only limited in our capacity to change things, to control what these viruses do. So viruses, they're going to continue to evolve. That's what happens. When we throw a wrench into the mix, it adapts, it evolves. And it's just this constant battle of back and forth, no matter what we do. A couple main differences between the plague of influenza of 1918 and COVID of today. For one, it's a different virus and COVID mutates at a very rapid rate. The other big difference today is the amount of globalization we have compared to 1918. So the virus is all over the world, it travels so quickly, and back in 1918, that wasn't possible. That's gonna wrap up today's Q&A. Sorry if I didn't get a chance to answer your question, but I'll try to in some upcoming videos as well. So go ahead and leave comments again, ask questions, and I'll see you in the next one.